So it's April 25th, 2015. I am 258 days on testosterone, which is what, I'm like 6 days short of being 9 months on T. And I'm 58 days from top surgery with Dr. Satterwhite. And I know it's been a while since I've done a video. I don't have much of an excuse other than I was just being lazy and didn't want to. I don't think I really missed anything as far as changes go in documenting them, so I don't, so whatever. Um, but I wanna get back on being a little more consistent with these videos, at least for the next 3 months until I hit my 1 year mark. Um, but so there aren't really any changes to talk about. Um, my facial hair is still growing in. This side isn't quite growing in as well as this side, and it's still pretty fine. I mean, you can tell it's whiskers because it's definitely thicker than it used to be. But and I don't shave with a razor just yet. I just usually um, use clippers and keep it just really short until it starts filling in a little better, and then I'll probably shave. But one of the nurses at work uh, was chatting with me one day, and she looked at my face and she said, "Oh my God, you need to shave." That was pretty cool. That's the first time anybody has said anything about my facial hair. So I don't I don't know if it's just the first time that somebody's noticed, or if it was just the first time somebody noticed and said something. Whatever, but it was kind of cool. Uh, I still have a little trouble with acne, but not too much. Um, I probably wouldn't. It probably wouldn't be as bad as it can be if I was more consistent with washing my face with the acne stuff that I got. Um, when I wash my face consistently, it's really good. Right now, I don't have much going on, but I usually have problems right in here. Big, ugly zits, but not right now. Right now, my face is cleared up pretty good. I have a small one right there that I just, and then sometimes right on my nose. Those are my most problem areas. But it's not even a huge problem, more of an annoyance. um, my body hair still there. Still it doesn't seem like it's changed much in the last month or so. um, and it doesn't really even seem much thicker than it ever was. It just seems like it's a lot longer than than it ever was. I was noticing, I was looking at my legs and on my belly, and I've got some hairs on there that I swear are over an inch long. But they're some of them are dark and thick, and some of them are just barely thicker than they used to be. So I don't know, but it's there, and I'm starting to get more. patches on my chest right here, and then I kind of have just like down, and it spreads out over my belly, which is, it's not my favorite thing, but I knew it was gonna happen. So um, my voice, my voice is still kind of up and down. Some days it's really good, some days it's not. Uh, it's still going through some changes, and I've noticed that I've been trying to work on the the tempo of my talking, because I noticed that if I slow down the way I'm talking, like more monotone, um, my voice passes a little better than if I were to talk like I always talked for the last 40 years of my life. Um, so I've been working on that, uh, and I'm still sometimes passing, sometimes not. Sometimes I still get that um, people going, "Hello, sir," I mean, "ma'am," kind of stuff, which bugs the shit out of me. But what are you gonna do? Uh, so, so that's about it for changes. Um, I'm still working on getting my name changed to certain places. Uh, Finally got it all done with my bank and my credit cards and my insurance. And just recently at my doctor's office. Uh, so far, haven't had much problem. Uh, I'm a little worried about uh, about my insurance and stuff, because it just they uh, seem they used one insurance number, member ID number, and it has two names, my previous name and my current name. So I don't know if that's going to cause me any problems, and I certainly hope it doesn't. But if it does, hopefully it doesn't. Hopefully it's not too stressful to take care of. Work is still going really well. A lot of some people are still uh, just finding out or just coming to realize. I didn't officially come out at work until February, uh, and I didn't make a huge announcement to the entire organization, just my department. So it's, slowly people are noticing that my name badge says Logan, and they'll ask me why, and I get a lot of people are apologizing. Oh my God, I didn't know. But I just tell them it's fine, because I didn't make a huge announcement, and I've just been okay with taking care of things as they come up. So, and so far, haven't had a problem with anybody. Um, Everybody's been really cool. They're still adjusting, just like the rest of us. I'm still adjusting. I keep that. There's twice in the last week I've had, I've accidentally started to sign my previous name on some documents, and it was so stupid. But um, so my 40th birthday was pretty cool. Small group of me and friends. We had dinner at a steakhouse, and we went bowling, and then bar hopped a couple of places until the wee hours of the morning. I had a good time. Uh, so, which is good because I was worried that that nobody was even gonna want to get together for my birthday. So um, I quit school with Capella because I don't like the online format. Um, it's too difficult for me. I guess my old brain doesn't quite function as well as it. So I'm looking for a program here in Tucson where I can actually attend a class, if even if it's just once a week. So I think I found two programs that might work. I still have to do some research and get some more information though. Uh, so my weight loss hasn't gone so well. Uh, I've just been in this strange funk, and so I have been lazy, and so I'm thinking, even though I'm 58 days away as of now, I'm thinking, I'm hoping, okay, I'm going to tell them that we probably need to schedule the surgery at a hospital rather than the surgery center because I'm not gonna make the weight requirement that they require. So I don't know how, if at all, that it's gonna affect my schedule, my surgery date, but I just think rather than waiting much longer, I just get it done, get it rescheduled as soon as possible. Um, so yesterday I had a doctor's appointment with my endocrinologist. My blood work, my CBC levels and stuff look good. There's nothing concerned. They weren't concerned with anything. My T level is right on target, I guess, whatever. Um, I had the blood drawn smack dab in the middle of uh, doses, and it was a 585, which is really good. Um, 4 months ago, it was right right in the middle of doses was 575, so it's doing good. But they they gave me the option of changing uh, changing my doses instead of doing it uh, 200 milligrams every 2 weeks. They they said that I could, if I wanted to keep the peaks and valleys uh, not so uh, varied, that I could start doing my injections weekly at 100 milligrams a week. So I started that yesterday with my first dose at 100. Um, I I'm not looking forward to weekly shots, but when I first started taking testosterone, this is how I wanted to take my doses because I think having the more level, um, my levels not so, you know, peak and then crash, go really, and then have an injection and go, whoop, it should maintain it a little better. I think maybe I'm, I think, I don't know because I'm not, don't know what I'm talking about. It might kickstart some changes, maybe, I don't know. Uh, so I'm interested to see if at all, the changes will kick back in, or if I'll notice, like, I guess I'm hoping that it'll help with like my facial hair growing in a little better. Um, I don't know. I'm just rambling, but so and anyway, I think that's about it. The only other thing I can think to share with anybody, if they even care, was that I had to put my dog down Tuesday, the 21st. My Shiloh was in a lot of pain, and it was time. But as you could probably imagine, it's been rough, and just with already being in a funk, having this blow to my emotions doesn't help any, and it's just sucks. But anyway, so that's what's been going on. Um, I hope to get back on track with making the videos. I don't know if I'm gonna do them weekly now that my injections are weekly, or just continue doing them bi-weekly, which would probably be better because I never have much to talk about anyway. So, but I can't think of anything else. No. So, till next time.